I'm Dr. Samir Ahmed. I'm chairman of the Department of Endovascular and Image-Guided Surgery. I joined Insight in July of 2022, and I've been here for over 1.5 years now. So I grew up in New Jersey, and I went to college at Cornell University, where I majored in neuroscience and biology. And then after that, I went to medical school at the Johns Hopkins School of Medicine, followed by residency at Johns Hopkins Hospital, and then a fellowship at Northwestern University. My area of expertise is endovascular surgery, and more specifically, I specialize in peripheral arterial and venous disease. Essentially, I've dedicated my career to opening up blood vessels and improving circulation in the legs and throughout the body for my patients. The best part about my job is treating complex vascular disease, especially in patients who have been given very limited options, such as amputation. When they come to me, they're usually in severe distress because they feel like they have nowhere to go and that they end up losing their leg. When I'm able to open up the blood flow in their legs through a minimally invasive procedure, it really is lifestyle changing, and I get great satisfaction from that. The best career lesson that I've learned thus far is to treat patients like you would treat your own family. And one of the ways I show that is giving my patients a contact that allows them to reach me at any time. Whether it's through the hospital or through my care coordinators, or sometimes even through my cell phone, patients know that they can always reach me, and if they have any questions, concerns, I will address that as soon as possible. One thing that surprises people about my job is that there are a lot of minimally invasive options to treat common conditions, such as uterine fibroids, peripheral arterial disease, and knee arthritis. A lot of the times, patients are only offered large surgeries, which carry high risk of bleeding, infection, and long downtimes after surgery. And these minimally invasive options are literally lifestyle changing, and they're done in a way that allows patients to have a procedure done with low risk of bleeding, infection, and a quick recovery. The reason I joined Insight was because of the people. The people here are amazing, they're hardworking, and they care a lot about patients. I'm also very mission driven, and the mission of Insight Hospital to provide the best care in the world to an underserved population is very important to me. When I'm not working, I like to spend time with my family. I have 2 kids, a 5-year-old son and a 7-year-old daughter. We love to travel. And I also really enjoy working out and watching movies. I don't know.